At the start of his administration, President Biden announced a break with the policy decisions that have led to this consolidation. He said, "We're 40 years into the experiment of letting giant corporations accumulate more and more power. And what have we gotten from it? Less growth, weakened investment, fewer small businesses, too many Americans who feel left behind, too many people who are poorer than their parents. I believe the experiment has failed," he said. Today, consistent with that vision, we are returning to America's long-standing anti-monopoly tradition. Healthcare markets are a key site of this work, and the FTC is squarely focused on tackling illegal business practices that deprive Americans of access to affordable and innovative healthcare. First, we are scrutinizing opaque middlemen across the healthcare supply chain. Today, I'm pleased to announce that we are launching an inquiry into how group purchasing organizations and drug wholesalers may be contributing to chronic shortages of generic medications used to treat everything from asthma to seizures to cancer. You all have seen firsthand how these persistent and acute drug shortages can, for very sick patients, literally mean the difference between life and death. In partnership with the Health and Human Services, the FTC will be scrutinizing how the business practices of GPOs and other middlemen may be contributing to these dangerous shortages, and I'm grateful to have HHS Secretary Becerra and FDA Commissioner Califf as dedicated partners in this important work. Our efforts to scrutinize another set of vertically integrated, concentrated middlemen in the pharmaceutical supply chain, pharmacy benefit managers, is ongoing. We've heard concerns from patients and medical professionals that the rebates that PBMs demand may function as illegal kickbacks that raise costs and limit access to affordable medicines. We've also heard concerns about how PBMs may unfairly discriminate against independent pharmacies, making it difficult for those pharmacies to stay afloat and depriving communities of access to the high-quality local service that they provide. Understanding how these opaque and complex markets operate is critically important for policymakers and the public, and we look forward to sharing our findings in the coming months. A second key pillar of our healthcare work is tackling unlawful consolidation and roll-ups. Empirical research shows that hospital consolidation routinely results in higher costs and reduced service, and the FTC has long been active in tackling these illegal deals. The FTC has successfully blocked over half a dozen healthcare mergers in the last 2 years alone. Our actions are putting industry participants on notice, and we hear that corporate deal makers are increasingly assessing the legality of the transaction at the beginning of the process rather than the end, showing that our commitment to law enforcement without fear of favor is deterring illegal deals. As we see hospitals expand beyond local mergers towards mergers of major national systems, we are updating our tools to ensure that we keep pace with these trends and continue protecting Americans even as business strategies evolve. As part of updating our tools, we also recently revised the merger guidelines, laying out a more fulsome account of the different ways that mergers can run afoul of the antitrust laws. For example, the new merger guidelines note that a series of acquisitions can result in unlawful consolidation, even if each individual transaction seems benign. Roll-up strategies across sectors, including healthcare, can make it especially critical that enforcers are looking at aggregate trends, not just isolated deals. Consistent with those principles, last fall we brought a case charging that private equity firm Welsh Carson had undertaken an illegal roll-up scheme to monopolize anesthesiology markets in Texas. After buying out nearly every large practice in Texas, Welsh Carson used its dominance to raise prices for anesthesia services, raking in tens of millions of extra dollars for the executives at the expense of patients and businesses. We are also following closely the empirical work examining the effects of private equity expansion into healthcare, and are alarmed by studies showing that some private equity buyouts have resulted in not just higher prices, but also dramatic degradation of quality, in some cases even resulting in higher mortality rates. A third pillar of our work is ensuring that antitrust enforcement protects all Americans, including workers. Our merger guidelines, for example, lay out a framework for considering how a merger may lessen competition in labor markets, which merger analysis in recent decades had neglected. That's why the guidelines outline how a merger that can give a company outsized power to cut or freeze pay, slash benefits, or degrade working conditions could violate the law. As part of our focus on labor markets, last year we also proposed a rule to ban non-compete clauses in employment contracts. We heard from thousands of workers, including thousands of medical professionals, about how these non-competes can harm healthcare workers and patients alike. Whether you're a doctor, a nurse, or a custodian, you should have the freedom to pursue better job opportunities without having to uproot your family or risk being sued. And for healthcare workers especially, you should be able to do that without having to disrupt the continuity of care for your patients. A fourth pillar of our healthcare work is tackling abusive practices by pharmaceutical companies. In the last year, the FTC sued to block 2 major pharmaceutical mergers, the first time our agency has outright blocked these deals in over a decade. The FTC's lawsuits laid out how these pharmaceutical deals would have deprived Americans of access to affordable, innovative drugs, worsening the affordability crisis that too many patients already face. We have also been policing unlawfully listed patents in the FDA's Orange Book, which can lock out generic competition. Last year, we sent letters challenging the legality of over 100 patents listed in the Orange Book, including those affecting devices used by millions of families, such as inhalers and EpiPens. Though obscure, we believe that these Orange Book tactics may directly translate into American families and taxpayers paying far more for these life-saving devices than they should be in a fair and competitive market. In response to our letters, several large manufacturers have already pulled down their patent listings, and we're considering next steps to help deliver relief for the patients and medical professionals that rely on these devices. Fifth, our healthcare work is focused not just on price, but also on privacy. Patients trust you and the broader system to safeguard their sensitive health information. But as more people use digital apps outside the confines of our traditional health system, your ability to protect patients' data is more limited. It's true that these platforms promise real utility, from helping people track their glucose levels to helping people find cheaper prescription drugs. But they can also pose a serious threat to people's privacy. What users likely don't know is that without their knowledge or consent, the sensitive data that they're sharing may get sold to the highest bidder for targeted advertising. Against this backdrop, the FTC is making clear that these companies must secure the sensitive health data that they collect. For the first time, the FTC is using and strengthening the health breach notification rule, so we can make clear to firms that sharing sensitive health data with third parties is a breach of consumer privacy. We've also brought a series of lawsuits against firms, including those providing health apps, that misuse sensitive health data, making clear to firms that recklessly collect, store, or share this data that they may be violating the law. Looking forward, as companies continue to rapidly deploy artificial intelligence tools, the FTC is committed to keeping the door open on all the promise and innovation that these automated technologies can offer, while also making sure we're protecting people from the riskier and darker side of this technology. We've already seen how AI can serve as a tool to empower and inform consumers, but we've also seen how it can turbocharge fraud, automate discrimination, and entrench surveillance. Through enforcement and rulemaking, we're protecting people from AI-enabled scams and making it clear that some data, including sensitive health data, is simply off the table for model training. While the full potential of AI is still up for debate, there is promise that these automated tools could make life better for millions of people, including yours as medical professionals. An AI tool that streamlines the onerous process of clinical note-taking could enable you to spend more time and energy caring for your patients in real time. And as you grapple with new and emerging applications of this technology, we're eager to hear from you about your concerns and experiences. Of course, when it comes to ensuring that America's healthcare markets are serving the American public, the FTC's tools are just one part of the equation. Stepping back from antitrust and competition, the Biden administration succeeded recently in enacting a new law, the Inflation Reduction Act, that will allow the government to negotiate certain drug prices, succeeding not only in helping to lower drug prices for Americans, but also in showing that this administration will stand up to powerful corporations that are all too used to getting their way in Washington. Just last month, CMS also finalized a rule that would ease the burden that some prior authorizations put on doctors and help alleviate the harm that they can cause patients when they delay care. As we continue this critical work, continuing to hear from you through our public commission meetings, open comment dockets, and public workshops will be critical across our competition and consumer protection work. It's one reason that I'm hopeful that the path we're on today will help build the healthcare system that American patients, doctors, and communities truly deserve. We recognize that there are many challenges in healthcare that the FTC cannot reach, but where we do see that our authorities and tools can make a real difference, we won't hesitate to act. Nowhere are the stakes higher than in our healthcare markets. Together, I'm hopeful that we can begin to deliver better outcomes for many of you, your patients, and your communities. Thanks so much for having me, and I look forward to our discussion.